Mr. Hadi Chaudhry, thanks so much for joining me today.
Thank you, Chris. Thanks for having me.
So before we dive into healthcare and digital health transformation, let's do a little introduction. Tell our audience of physicians a little bit about yourself and your company.
Sure, absolutely, Chris. My name is Hadi Chaudhry, and I'm the president and CEO of CareCloud Inc. It's a publicly traded company. We are listed on NASDAQ Stock Exchange. We went public in 2014. We provide tech-enabled revenue cycle management services in healthcare industry. And in addition to that, we have a full suite of proprietary software solutions, including an EHR, practice management, patient engagement, and digital health solutions. Today, we are serving over 40,000 providers in all 50 states of the United States. And our clients include either 1 to 5 doc single location practices to multi-location practices with multiple thousands of providers. We do also work with health systems on platform agnostic revenue cycle management services, primarily in the ambulatory and outpatient space. And diving into a little bit of the history about the company and myself, CareCloud was formerly known as MTBC, or Medical Transcription Billing Corp. Company was founded in 1999 as an old school legacy medical billing and transcription company. We started with a vision of transforming RCM, or revenue cycle management industry, into a tech-enabled revenue cycle management and providing an end-to-end, fully integrated solutions for medical practices at a very in a cost-competitive way. We started investing towards proprietary platforms and launched our first claim management system in 2003, followed by our practice management system and EHR in 2005. And today we are on the 4th generation of our platforms, which we can talk further later today. And a little bit about myself. By education, coming from finance and IT background, I joined the company almost since its inception, or close to the inception, in 2002 as manager of IT. And the task that was given to me on my job was very simple: bring that vision to reality from the technology point of view. And that's from where I started with this organization. And since then, I have worked in various roles, including general manager, CIO, VP of global operations, president, and now the CEO.
Great. Thanks so much for that very thorough and succinct intro. That was great. Let's talk big picture. Let's pull out the crystal ball a little bit. Where do you see the healthcare industry heading in the next 5 years?
Great question, Chris. I think we believe that we will see a significant shift towards the value-based care models. The digital and preventative health initiatives will get more and more attention, such as the chronic care management or remote patient monitoring, as an example. The use of remote monitoring devices will significantly increase as more and more advancement is taking place in medical devices. Many of devices are becoming available as off-the-shelf devices as well. And there are many various of those which are getting the FTC approval as well. So the data can be collected remotely through those devices and can be collected and stored into the EHR system, and the decision can be taken from those systems. So we see over the next 5 years, that's going to get a lot of attention. The use of AI and machine learning will get a lot of attention, and more of that is expected to be utilized over the next 5 years versus it is today. Though it's not a new topic, but with the recent development with tools such as ChatGPT, and I think now we believe that the transition will be much faster. I would use an analogy similar to how recent pandemic has put a lot of virtualization on fast track. The ChatGPT is going to become a pandemic for advancement in the field of AI. So I think that's what we think over the next 5 years. This is how the healthcare industry is going to change.
So obviously, one of the major challenges that has happened in healthcare in recent decades is sort of the digitization of the healthcare space. What would you say are the emerging trends that have had a major impact into your decision making as your company has worked towards digitization?
Sure, Chris. For sure, pandemic was one of those which forced everyone to think more towards telehealth and digital health, and then at the same time, importance of remote patient monitoring and the similar solutions. Though we launched our telehealth solution at least an year before the pandemic hit, but the pandemic just created the more urgency or more the needs for coming up with similar solutions which can help the practices and also the businesses. The recent development in use as another example as the use of this AI and machine learning with I think everyone today is talking about the chat GPT and the tools like that. This is going to put this use of AI in the healthcare industry on a really significantly on the fast track. So that has created a move for us within our organization from the decision-making perspective that we need to spend some more dollars on R&D and the development and development of certain tools, AI-based tools. The value-based care models and the industry is already gradually moving towards the same. But the next 10 years you will see, or 5 years to 10 years, you will see a massive movement towards in the same direction.
So you had mentioned COVID-19. I think we've been kind of talking about that a little bit in our conversation so far, but it obviously caused a lot of chaos in healthcare, both from a clinical standpoint, obviously, but also with, kind of the shift in how we were doing things with, admin staff working at home. And I'm just wondering, like, at your experience with CareCloud as you went through this process, what were the main factors that helped healthcare facilities navigate through sort of the ups and downs of the pandemic?
Sure. I think the first and foremost, the fundamental was how to leverage the telehealth technology. And if I share some of the numbers with you, uh, when we launched in a year before the pandemic, somewhere around 2017 or 2018, at the time of pandemic, when the pandemic hit, 0.1% of our appointments were telehealth related. Pandemic hit and the numbers went up to 27-28% of the overall appointments. So which means the practices started to adapt to the telehealth solution. And then after COVID, this number has normalized somewhere around 6-7% now. And now it's gradually increasing as the practices are feeling more and more need of it. So those are these kind of the fundamental things that the practices have adapted during that time frame. From the staffing standpoint, virtual meetings, use of Zoom, use of Teams, and similar other virtual meeting platforms. Kids are taking classes, their school classes using those tools. So the practice staff, they adapted to those, and which helped them bridge some of the gaps of communication between staff while they are working from home. Patient engagement solutions, that was another thing. The practices started investing towards more robust, more technologically advanced patient engagement solutions, such as you don't need to get in the office and sit and wait in the queue for your turn to come. You just pull in the parking. Your app, your patient engagement app, the PHR app will prompt you. You can check in sitting in the parking. And when your turn comes, a notification will be sent to you and you can go in and can see a doctor. Staff augmentation by taking help from many other organizations, where, as an example, we have a global team of 3,500, 4,000 employees that from different regions, from different countries. Not all the regions were impacted at the same time in the same way. So many companies similar to us and the practices, they were able to leverage those resources. We also have seen the increased adoption on the robotic process automation bots. It's an AI-based robotic bots which can take care of many of the mundane tasks, taking the patient's call, rescheduling or booking the appointments automatically, making sure the denials gets resubmitted automatically by attaching the required medical documentation and the like. So we have seen many of these or various these steps that the practices have adapted to during pandemic to improve the workflow.
We had talked a little bit about AI and machine learning. But how are they? Let's talk a little bit in more detail about how they are impacting the future of healthcare technology. And are healthcare facilities equipped to use these AI tools in their systems right now?
Yeah, I think that's the most interesting and the hot topic nowadays. Some basic AI and machine learning based systems are already supporting healthcare organization and streaming their workflows from the administrative perspective, such as AI based, whether it's the voice assistants or the robotic bots I just mentioned. So they're taking care of certain administrative tasks. There could be some AI implemented on, as an example, the healthcare system, the EHR or the practice management there the practices are using at the time of discharge. System can provide some recommendation that these are the 10 things the patient will have to do when the patient goes home. The more sophisticated models with widespread implementation, those yet needs to happen. It can help in many ways. As an example, for diagnostic assessment, AI can examine enormous amount of data from EHRs, lab reports, radiology images, and comparing it across the patients, finding patterns, finding associations, and can then suggest the right diagnosis. Responsibility would still remain with the healthcare providers because it's still a recommendation. There is always a question of, or the concern of, which is true, that what was the size of the data on basis of which the recommendation or the AI is learning and recommending the diagnosis. There could be many other areas. It could be identification of the rare diseases. It can help in drug discovery. So the benefits are enormous, and we see that this healthcare organization moving at a much faster, with a much faster track than what it was before over the next couple of years.
As the CEO of a global company, what initiatives are you taking at CareCloud to minimize the impact of just the challenges that are out there in the healthcare industry? I think all of our audience is familiar with some of those challenges, but I'm just wondering, like, what you guys at CareCloud are doing to help minimize them.
Sure. I think the one thing is making reasonable investment towards an R&D. We need to invest more in finding the solutions for interoperability. As an example, that's one of the challenges today. We need to invest some R&D dollars in coming up in developing the solutions for AI and machine learning base, the digital health focus towards specifically towards remote patient monitoring as an example, because that's going to help the overall industry move forward. And we believe that over the next, let's say, 10 years, if you think about it today, the most of the appointments are driven by the patient. So when you feel you're getting sick, you pick up the phone or go online and make an appointment and go and see a doctor. Over the next 10 years, we believe that most of the appointments will be driven by the healthcare providers. And how that's going to work, with the help of the same tools, with the help of the same remote devices, the data is already being fed into the system. And then the AI layer will come in and can look at the different combination and guiding the healthcare provider, saying, these 5 patients in your patient list could potentially have this problem. Reach out to the patient to schedule an appointment. So I think one is we are investing towards the R&D and focusing towards the development of many of these solutions which can help the healthcare industry. And in order for us to remain cost competitive, we are trying to make sure we keep the right balance between the US-based workforce, offshore workforce, how to effectively manage the global workforce. Otherwise, all these solutions that we are talking about, whether it's us or someone else, this will become too expensive for a small practice to afford the solution. Same case that we are trying to invest a lot towards the training of the healthcare providers on upcoming technologies and automation in this industry. We are conducting a lot of webinars and probably the user-based trainings, the events, the conferences where we can train our providers to get them ready for those upcoming challenges.
Obviously, technology is fast moving. It's hard to stay on top of it. As a CEO of a tech company, I'm just wondering how you stay on top of the tech trends And are there any channels or books or other sources that you use to they follow to keep yourself updated? I think our audience would be kind of eager to figure out like ways they can stay on top of things.
Right, to your point, Chris, this is a rapidly changing industry, very dynamic industry. The technological changes are coming with a very fast pace. There's no one single or a silver bullet to make yourself aware and up to date with all the developments taking place. But they could be, as an example, there are apps such as Flipboard. What it does is it picks up news from different resources and consolidates for you. So you instead of going through 10 different resources, the news channels, you can have one app which can consolidate your interest in a consolidated way, so you can be more effective instead of reading it from one location. Attending the conferences is very important, and I think in the healthcare space, HIMSS has always been a great conference. It's always spent a couple of days, and it's coming. The next one is coming up in Chicago in this later this month. Over this 3 or 4 days, there are a lot of training sessions. You're able to even see and meet with other vendors. That helps us and everyone in the industry stay up to date with the trends. Other than that, there are many other websites such as Healthcare IT News, TechCrunch, Fierce Healthcare, Modern Healthcare, Health Leader, and etc.
So since you've worked in the healthcare industry, you spent some time in the banking sector, you were in the health IT space for the past 25 years. I'm just wondering what you think is sort of the driving force between any industry, healthcare or any other, that contributes to growth and success. Our physicians are business minded and they're always looking for, advice on how to kind of take their business to the next level. I'm just wondering what you've learned in your career that maybe would be helpful for them.
Great. As you mentioned, that Chris, regardless of what sector you're in, the business fundamentals remain the same. As an example, talking about the financial industry or the banking industry, I would say adopt to the change quickly based on the industry trends. If you think about it, 20 years back, there was no way for anyone to deposit a check unless you go to the bank and deposit it in the bank by yourself, or you can go to the ATM in some cases and deposit the check from there. Today, you can use an app, scan your check, and can deposit it. So all the banks which take the initiative and going through that change instead of resisting to the change, they were able to stay ahead of the curve and survive in the industry. So I think whether it's that, whether it's the use of the AI nowadays, the sooner we accept the change and start focusing towards it, it's better for everyone. Otherwise, you will be left behind. Do invest in the R&D, because sometimes organizations do not feel the need and the importance of spending on the R&D, which can help them in the long run. Stay focused on technology adoption, automation, and keep eliminating the redundancies and inefficiencies in a planned, strategic way. Not that one day you think about, we will sit and start planning and making this strategy for eliminating a redundant system. It has to happen. The adoption has to keep happening. So this is what I've seen, whether it's the financial sector, whether it's the healthcare sector, which can help any of the organization growing.
Great, thanks for that. Are there any challenges in health IT or roadblocks that you've often faced when dealing with providers?
Yeah, we do. One is the adoption of the technology, and that's many times mostly comes from the staffing side than the doctors. We are able to still convince the doctor about the new technology, but when it comes to the staff, they take a lot of time adapt to that new technology. The second thing is there's resistance to the change. Even though, they understood, they accepted the technology, but the change, even the way they were charting before, and according to the new technology, the new software, if the process or the workflow is changed, and it could even be a better workflow, but that change, there is a resistance of the staff. They take a lot of time in changing the way they used to do certain things. And the third thing which we face is the training, the importance of training. They forget to understand that it's very important for them to actually understand and get the training on how to effectively use a system, whether it's the software platform or it's even if it's a certain device in the medical field that they need to use.
When you first proposed the idea of transforming the healthcare space, using digitization, easy for me to say, did you face backlash to that? And what measures did you take to kind of make awareness for the healthcare industry on the positive impact that it could bring?
Sure. I would not say that we faced a backlash. We have been lucky in certain ways, but sometimes there have been certain challenges or the hindrances, I would say. As an example, and actually, let me just step back. This concept of digitization is not new. If you think about the 1990s decade, the medical transcription concept was started, which was the first or the very basic concept of medical records digitization. After seeing the patient, you can just transcribe everything. There is someone sitting either in your own office or another company who can listen to the recording and can transcribe a document, and you can just save it as a Word document on your computer. That was the first step towards the digitization, other than the EHR system, or actually it's just the EMR systems implemented in the health system space. And then if you think about the decade of 2000, the government's initiatives towards EHR, they'd become a sort of a tailwinds for us and helped us achieve our goals towards why the EHR is important, why the tech-enabled revenue cycle management is important, why the use of a practice management system is important. So those initiatives really helped us in moving forward with those goals. If you think about the decade starting in 2000 and with 2010 and onward, there was a more focus towards implementation and demonstration of the meaningfully using the EHR system. So that again helped us. There was a system, but in order for the practices to use it effectively, the government initiative with the carrot and stick mindset helped us really well in making sure our system gets implemented and used properly. We launched telehealth solution, as I mentioned earlier, a year before the pandemic. Pandemic hit after a year. That really helped us from the adaptation of the telehealth solution. There are many practices who started to leverage and started to use the telehealth services. So we don't see any backlash, but those were the different challenges, whether we call it resistance to the change or the overall industry accepting to that new way of doing the things.
Yeah, as the CEO of a health IT firm that deals with patients, sensitive data, what are your thoughts on, sort of the rise of cyber theft and data leakage and these things? And I'm just wondering what preventative measures that CareCloud takes, in the long run to sort of protect this sensitive data.
Yeah, there's a great question, Chris. Every organization today, regardless of just the health sector, is concerned, of course, about the data security. But financial and health sector has always been on the top of the list for the cyber attackers. Every organization that we believe, and that's what we do, not only focus on the external measures, the external safety measures, but we at the same time also focus on the internal safety measures, because many times it's the internal weaknesses that helps an attacker leverage either a weak internal system or an employee to launch an attack. So we have a dedicated department of data security and compliance. They take all the measures, including training and awareness from the employee standpoint. They conduct internal and external audits, the penetration testings, and all the industry standard external testing. We have some very strict internal policy-based rules based on the location of the employees or the organization. As an example, the USBs, the peripherals cannot be used. Even if you plug the USB, you will not be able to use it. On the floor, you cannot take your cell phones during your work hours, where you can take the picture of the screen in order to make sure we are complying with the HIPAA and the like. And then we have some of the external third-party, very renowned, industry-renowned threat management vendors who constantly monitors our network and the computers from external and internal data perspective to identify and stop any potential threats. They even monitor the trends of the traffic on the network, and if there is a change in the data pattern, the traffic pattern, it raises an alert, and before anything happens, they jump in and quickly block and tackle that situation. And then in addition to that, we have trained the organization, was able to obtain many industry leading certification from the data security standpoint.
Great. Thanks for sharing that. I'm always interested in cybersecurity. It's just a rapidly changing, kind of threat level. But so thanks for talking about that a little bit. Let's go back to Chat GPT for a little while. We talked about it a little at the beginning, but everyone is talking about this, and I was wondering. Yeah, I think our audience is kind of curious, and me personally, about what you think about Chat GPT and these language learning models and what they mean for the healthcare space.
Yes, because and this first of all, it's absolutely going to revolutionize the healthcare space, similar to many other sectors today. I think it's just has put the AI adoption of the AI, investment in the AI, use of the AI on the fast track. And I think everyone knows the first concept of Chat GPT, where many years back when Elon Musk talked about the safe AI, the regularized AI, the concept was, let's develop the AI which is regulated, which should be called a safe AI, which other organization can leverage instead of trying to come up with their own AI, which may lead to other consequences. So that's from where it started. Right now, I think the entire industry is working on many possible use cases, or how effectively we can utilize some of the APIs of the Chat GPT, and we are investing and working towards the same. But I think what it's going to be is, if we just talk about the diagnosis, the rare disease, the discovery, as I mentioned earlier, or the medication, which right medication can be used. There can be a lot of these things which can now be worked or diagnosed and reviewed and suggested with the help of the different AI. And ChatGPT is just one major platform. It's like Google just came up with its own, and many organizations will be following through with the same track.
The other concern, obviously, that always comes up when you talk about AI is whether it'll impact, jobs. So do you think AI could take over human jobs? What do you see the relationship there between, AI and sort of the workforce?
Okay. I believe this is probably the wrong way of looking at the thing. That's how I look at it personally. If you think about it, many jobs that exist 20 years before, that doesn't exist today. And in the same way, many jobs that didn't exist 20 years before, they exist today. So it's part of the evolution. It for sure will cut certain jobs, but will at the same time introduce many other jobs. So we just, as a human being, I think, just have to evolve, and it has to happen. Sooner we accept it and change ourselves, it will be better for us and more beneficial. So there will be more ways, there will be more jobs added. Just merely, instead of thinking about the negative side that the job will be cut, yes, there will be some impact, but there will be a positive side by introduction of new jobs.
Yeah, that seems to be the pattern whenever there's a disruptive technology. It seems kind of baked into the way things work. So thanks for sharing that. My last question for you today is, just as a leader, as a business leader, what advice would you give to new entrants who wish to sort of prosper in the healthcare industry?
Great. I think one thing is, step in with the mindset of challenging the status quo of the healthcare industry. There is a lot to be changed. We can talk about many of these examples, talking about the interoperability as an example. The industry needs some drastic development in the interoperability side. There is a lot which is taking place, and we're going to get there. But step in with the mindset of challenging the status quo in as many different aspects and the ways possible. Do invest, always keep a room for R&D, research and development. Specifically talking about the industry, as I talked about, focus on interoperability, come up with a fully integrated solutions, and focus extensively on AI and machine learning. On the soft skill side, I think it's change quickly. Don't take too much time in taking decisions. Don't afraid of making mistakes, but taking decision is more important than not taking a decision with the fear of making the mistakes. And that will be my recommendation.
Mr. Hadi Chaudhry, CEO of CareCloud, thanks so much for joining me today and sharing your insights. I really enjoyed our conversation.
Likewise, and thanks for having me once again. Thank you, Chris.
Thanks.